Hello, everyone. My name is Zeph, and welcome to the Star Network podcast. Today, we have with us a special guest, Dr. Yewande, who's the COO and co-founder of Helpstation. Hi, Yewande. How are you today?
Hi, I'm well.
Good to have you on the show.
Same.
Are you excited to be here?
Yes.
I feel like we've been planning this for months, and now you're finally here. Great. So, Helpstation, people want to know more about it. I know when I saw the proposal from your team, I said this is definitely a conversation that needs to be had. So, just surface level, it's ambulance servicing, but you're better positioned to explain it. So, what is Helpstation trying to solve?
So 3 things. There's the lack of access. And then there's also the lack of coordination, and then lack of a communication system in pre-hospital care. And so what we realize is that there's a number of deaths that is caused by lack of access. In fact, let me rephrase that. Preventable death, right? Death that did not need to happen, that is caused or that stem from lack of access. And then also poor coordination, which often causes delay, right? And delays are often fatal because it's an emergency. And then you also have communication between the different stakeholders, from the emergency incident site to the ambulance company to the hospital, right? So all of those important stakeholders, in that ecosystem, how do they communicate with each other during an emergency? A failure of having an effective communication system can exacerbate the situation, right? And so those are part of the things we're trying to solve. A study done in Lasuth, Lagos State University Teaching Hospital, has shown that up to 70% of patients pronounced dead upon arrival was as a result of deficiency in the system, deficiency in pre-hospital care. So pretty much that's what we're trying to solve.
Amazing. And thanks for that data. I know, healthcare in Nigeria is such a hot topic. It's ever evolving because one, there is so much need for improvement, especially given the number of our population. A key thing that many people always worry about is emergency services, or even if there were to be an accident on the road or a family member were ill, people usually tend to say, I don't even know what the first line of emergency response is. The citizen is likely to just put the patient in their car and drive the patient to the hospital, and they do that through a state of panic, etc. I can't even imagine. So it's good that there's Helpstation to provide the ambulance servicing. But a question for you is that what should people be doing, one, up to the point that the ambulance is arriving, and two, now that people are hearing about Helpstation through the podcast, what number do they dial? Is there like a short code? How does it work?
To answer your first question, we have a 24/7 helpline, which is available for phone first aid support. So you're able to call us. On the line is a certified paramedic who can guide you, assure you, reassure you, and tell you the things that you need to do whilst you're waiting for professional help to arrive. That's one. Of course, we have a line, but first of all, there's the Lagos State number, which, to be honest, works. A number of people have called and they've gotten prompt responses. So I'm not very quick to shove off that. The federal line is 112.
Is that rapid response?
Yes,
okay.
It is 112. The Lagos State line is 767. And of course, Helpstation has our helpline. If you follow our page or go on our social media, you'd find a number. Is it called? We are working on a short code, but there's a lot of regulation and policies, for that at the moment that's hindering that. But hopefully we have one soon.
That's interesting that you mentioned that, because I was going to ask, is there a specific short code? I think even just for people's memories when they're panicking. Why is there regulation? Is this something you can share? Or you're not at liberty to disclose just yet?
I think it's public info.
Okay.
And I don't think it's specific to healthcare.
Okay.
Right? It's just a general NCC policy. I
got
think
it.
maybe a lot more people have been, I don't know, to be honest. But I know that there's regulation. You just can't have a short code except you're in the telecom space.
Oh, fantastic.
So, yeah.
Okay, good. No, thanks for this. And I think people can benefit. You've shared 2 critical numbers. I didn't even know that it was 767.
767.
Exactly. I know of
Lagos.
rapid response. I found myself in a situation with friends years ago where we were driving once and the car just broke down. My friend's car broke down and we had driven in front. And so they called and said, our car has broken down, and before we could turn back to meet them, I then remembered the rapid response number. When they called, they were there. But then I've also heard in certain instances where you call and the number is not, it's not very like forthcoming. So we're really looking forward to people like Helpstation to, accelerate that process. So hopefully that regulation is like down. But when you talk about ambulance service provision, one thing that comes to mind is Helpstation more an aggregate of ambulances from different hospitals? So someone listening may want to know, how does it work? Do you aggregate the ambulances or do you have your own independent ambulance services?
So when we thought about the problem, we realized that it wasn't a lack of availability of these resources, but rather a lack of access, right? And so we decided to aggregate the ambulances for many reasons. First is to be able to have a rich network that can cater to the demand, and then also to reduce the response time. And then when we looked further into the issue, we also did realize that you have a number of ambulances parked in the parking lots of hospitals, private ambulance companies. And then on the flip side of it, you also have a number of emergencies, and most of these, I'm not sure 3, 4, 5 years back, you would hear the news of an emergency, and you would hear that, but we called an ambulance and the ambulance came, and it's usually fatal. It's usually like, something has happened, and, so we saw that there was also emergencies happening every day and people just didn't know who to call or what to do, right? So for us was, how do we bridge that gap, and so like I mentioned, we've aggregated these ambulances on our platform. And we also realized that with aggregating the ambulances, you're also empowering these hospitals, the ambulance providers, right? Creating more visibility for them. But bottom line is saving more lives, really. Lastly is, yes, we do have our own ambulance. And we have done this just so that we have a certain level of control over emergencies, because there are situations where you call and the partners are not available, regardless of the network that you have. And so for us to keep our promise of that reduced response time, it was important for us to have a bit of control on the situation. And our amble cycles are also our own assets. So yes, we do own, 1 or 2.
You mentioned something on the time reduction. Can you just share very quickly what that time has now been reduced to, what it was before generally and what it is now? Yeah. And is the ambulance service, when you aggregate them, is it according to location?
For response time, we work with less than 20. To be honest, less than 20 minutes. Yes, please, not hours. 20 minutes. When we initially started, we were looking to less than 10, but we need to meet the industry where it is. And also understanding the problems, it was safer to promise less than 20. And I'm proud to say that we've been able to do that. And in fact, we actually do less than 15. However, industry standard prior to all of these ambulance services is 3 hours, 5 hours. Yeah, 3 to 5. In fact, I had my uncle call me. This was last year. And I just walked in and he was like, "Young lady, what you're doing is very, very good. Like, very good." And in my mind, I'm like, "You already know what I'm doing. Like, you've known what I've been doing forever. Like, why? What's new?" And then he says, he lost a friend and they were trying to get an ambulance to just move the body. And they spent 5 hours calling different hospitals, trying to get just one ambulance. And to be honest, even though an ambulance is not the most or best way to move a body, right? But still, it just shows the problem, because that could have been an emergency situation instead, right? And so yeah, you have people waiting 3 hours, 5 hours.
Yeah.
And so we've been able to crunch that down to 20
minutes. No, that's good that you share that. And that's very painful to hear. And I think a lot of people in the audience, that's quite painful to hear.
Yeah.
But yes, what you are doing is extremely impactful. And like I said, when I saw the proposal, I said, this has to be shared. I know a lot of people will benefit from this just on a national level. So continue the good work.
Thank you.
But I think a key thing is, when we talk about healthcare in Nigeria, we can't take away the element of the person that is behind the face of the healthcare, or the team that is involved. It's still something that Nigerians tend to worry about, or rather, let me just say, the competency. And when you then say you're calling an ambulance service, the first thing that will come to an average Nigerian person's mind is this ambulance that is coming, and the doctor or paramedics, and maybe I'm not using the right medical terms. Okay. Is this person qualified to actually come to help with the emergency at hand? So how does Helpstation ensure that there is full verification process, that your staff, your paramedics are highly trained and qualified, essentially like what you see on TV, that the person comes, they know what to do. What is that vetting process like? And while the person is waiting at home, what should they be doing? Or is that a very difficult question to ask, because it may be subject to the case of what is happening to the patient?
Well, I'll answer. So I think first thing is, we have a standard for onboarding. So remember that we don't own all the assets, they're owned by a third-party company. But we do have a standard for onboarding. And we work with HEFAMA. HEFAMA is an accreditation body for both hospitals and ambulances. And so they have a standard. And we have modeled our onboarding process, according to that standard. And if you look at their websites, there's a list of what each of these ambulances should have. And by each of these, I mean, you have your BLS ambulance, which is the basic life support. And then you also have your ACLS, which is advanced cardiac life support ambulances. So there are other specialized categories for ambulances, but these are the two major categories. And so there's a list for each of the category, right? And we onboard based on that list. If we do find that you don't have all the requirements for any of the category, we cannot onboard you. However, we do encourage people to, just get all the things necessary so you can join the network. That said, we also do inspection. So the moment you come up to us and we've done the preliminary registration, the next step is to inspect. And this is us doing our own due diligence to know that you actually have the things that you claim to, and be sure that you are able to respond adequately. And then I think the last phase is also the medical professionals, the ones manning the ambulance, whether you're a nurse, you're a paramedic, or a doctor. Do you have the certificates, right? So we go the extra length to actually collect and vet these certificates just to be sure. And of course, on our own end too, we can't be found wanting. So our ambulances are also up to the standard, and then our paramedics are also certified.
Thanks for that. And what should people be doing? Should there be an emergency and they're waiting for this ambulance to arrive?
So I'd shared earlier that we do have a helpline, 24/7, manned by paramedic, and we fashioned it that way just so that you have someone who's trained and knows exactly how to decipher the situation, even on the phone, right? We're able to ask some questions to pull out the information we need so as to be able to tier the type of emergency it is and the severity of the emergency. And so, but more importantly, is to be able to just give you the necessary steps, what to do whilst you're waiting, but also to get you the help that you need fast, because we also know that people are panicking. So a lot of times, even when you're trying to speak to them, they're like all over the place and all of that, right? So as much as possible, we do more of reassurance, and try to get them the help that they need fast.
It's interesting to see it involve, you said something that's very important. You said we need to be able to meet the industry where it currently is, and how you wanted to fast track the response time from 20 minutes to 15. But, Helpstation has been able to consider where are we currently operating?
Yeah.
And based on where we're currently operating, here are the downsides and the risks. So therefore it's 20. Yeah. Speaking about challenges, what key gaps have you identified? So, the most obvious one is that why should people have 3 to 4 hours in delay in calling an ambulance? But apart from that being obvious, what other key gaps have you identified in this space that has actually encouraged you to continue the work of Helpstation?
There are a number. There's a lot, to be honest, but I'm going to cone it down to 3.
Good.
First is the paramedic gap. Unfortunately, we don't have enough paramedics. Currently, we only have 2 universities in Nigeria that offer paramedic courses. And shockingly, Lagos is not part of those 2. Right, the 2 universities are in Benin and Delta. So if you need a paramedic at the moment, apart from the ones who have already migrated to Lagos, you have to actually interview from Benin, Delta. There are other like polytechnics that offer, but yeah, we have that, paramedic gap, which needs to be addressed as soon as possible, because I think they are an important part of the ecosystem. Then we also have outdated policies and legislation, because it's not an industry that is being looked into. And I think generally healthcare in Nigeria is not just something that looks like priority, So, and then if you then bring it down to a niche like emergency, care, you can imagine that is completely overlooked. And so we have policies, legislations that need to be, updated for us to have like effective emergency management. And then just being able to get like a comprehensive framework, right, to be able to support, efficiency. That's 2. And I think the last is funding. Of course, we can't talk about anything without funding. I think it affects everything. From data and technology management to supplies, to trainings, to being able to scale, to maintenance. It's just funding really, across board. Those are the 3 major things.
And I think, you've shared them well. I think the funding story is one that every startup complains about.
Yeah.
But, health tech, you see a lot of companies in the health tech space, and funding remains a huge issue.
Yeah.
But it's surprising to me as well, on your point that you have to either go to Delta State or in Benin to be trained as a paramedic.
Yeah.
And I'm sure the audience is going to be shocked. I'm quite surprised that Lagos doesn't offer this curriculum, but a solution on the 2 things, on your policy and the training, is why don't those universities do like a knowledge transfer? So rather than being there physically, right, there could be an opportunity where you do online courses supported by those universities, and then maybe like Unilag or LASU can bring that on. I'm saying this and sharing it because I'm not in the medical space, but someone like you who's in the space can run with the idea and implement on it. And similarly with the policy affects everything. So I like that you highlighted that. It's people like yourself who get it and you see the gap and you're actually trying to solve the problem. You can come up with a policy framework. And I don't know whether they call like Helpstation to like stakeholder meetings, but these are the things. These are the solutions.
Absolutely.
So I'm happy that you highlighted, and I think even people that are listening that are interested in your business, somebody may actually reach out to support as well.
Please reach out.
What would you say in terms of the uptake of using a short code to call an ambulance? From your data, has that has there been a positive uptake? Do you find that people still just in an emergency, they use their cars and they drive family members, or are they actually calling the emergency numbers?
Social media has also helped to spotlight, emergency incidents. And we've seen severally, online where something happens to someone who's popular, and they're like, why didn't they this? Why didn't they? Right. And I think one of the most recent ones, where they're taking the person to a herbalist or something. Yes, and this happened in 2024, right? And so it was a lack of access, a lack of knowledge, and a lack of awareness that happened to that person. That was a death that did not need to happen. Right. So, but these are the things that social media is helping to highlight, and so we are seeing the urgency of the situation. So yes, I remember that when that incident happened and we had posted a how to do CPR video, right? We actually had a lot of people, slide into our DM to say, they have an event, they want a paramedic on standby, they want an ambulance on standby, and all. So yes, so social media has helped. COVID has also helped in uptake. And then there's certain policies that are coming up now that's also helping. But we're very far from where we need to be. There's still a lot more work to do. We still find majority of people going with their cars. And I cannot blame them because the system has proven to be unreliable, right? When you think about the 112, for instance, in your mind, you're like, will they even answer? Will they pick the call, right? So that lack of trust in the system, also affects even we in the public sector. So it's like, even if I call, how long, I'd rather just take my car that's parked right in my compound, right? But the benefit of a proper vehicle, right, is that you are getting care in transit. So that if traffic, which would happen because you're in Lagos, if it does happen, you know that the person is receiving care while in transit. And what I've also found is, surprisingly, people don't even know what an ambulance looks like on the inside. We've had people, and I'm saying learned people, I'm not saying, just being all like, oh, wow, you have all of this. And I'm like, what did you think an ambulance, it definitely
shows
isn't.
The inadequacies of what exists.
Exactly. And I remember a very popular person, there was like a lot of uproar about the whole situation. And they were rushing this person to the hospital. And in the comment section, what I was seeing is, why are they rushing him to the hospital? Why, to be honest, I can't even remember all the comments now, but everything apart from why is he in a car? Nobody pointed like, why is he not in an ambulance? It was like, oh, why is this person saying this? Or why is it, it was just a lot of other comments that had nothing to do with the proper way, and so that shows the level, of inadequacy in the entire space. So nobody asked the question of why not an ambulance? Why is he in his car? So yes, social media has helped to highlight, but we still have a long way to go.
Yeah, no, 100%. And I think the more that Helpstation contributes to this value chain and showing people that there is an ambulance service that works, your short code minus the regulation once it's out, it actually works. That will then remain top of mind. But it's almost that people can't contribute or converse to something that they haven't necessarily experienced like efficiently themselves.
Yeah.
So again, continue the good work and be resilient. But just before we go, a question that I have for you is, what are your expansion plans at Helpstation? Is there something you want people to know? And then the last question that I always ask all my guests is, what is your favorite quote and why?
Okay. Expansion plans. So we have something cooking actually. And you mentioned about, the government. I think we've spoken a bit about the government, and I think that they have a huge role to play. There's only so much the private sector can do. And I would even say there's only so much the public sector can do as well. I think we need a healthy collaboration for us to make this work. So yes, we're cooking something. We're working very closely with Lagos State, in order to see how we can scale this and just make this available to every Nigerian as much as possible. And then we also have our digital first aid training. So one of the things that I didn't mention is first aid trainings. In the grand scheme of things, this is something that seems like a low-hanging fruit, but has a very huge community impact. And being able to train your everyday people on the, basic skill, to administer first aid, or to do a CPR, right, is very, very essential, because we've realized that the first responder in an emergency is often the bystander who is available to intervene before professional help arrives, right? So rather than people pulling out their phones to record, oh, this is happening and there's that frenzy, or everybody just screaming, you can actually do something and, change a life. And we talk about the golden 5 minutes, in medicine. It's the 5 minutes that kind of dictates the outcome of that emergency. What you do in that 5 minutes goes a long way, right, in influencing outcomes. So we have a digital first aid training, and I'm very excited about this one because we haven't launched the product in a while. We've been concentrated on our service line. So this is something that I'm really excited to share. But it's not just another digital first aid training. It is actually a culture fit.
Okay.
So
languages, inclusive,
yes,
fantastic.
yes.
I like that. Good.
So we're breaking these down in indigenous languages. So
Fantastic.
you have your vernacular, which is Pidgin. You'll have Yoruba. You'll have Igbo, Hausa.
Very good.
And for us, it is, how do we train people on a community level? How do we penetrate deeper into the community? And how do we create an emergency conscious society, such that, again, you're not pulling out your phone to record, but you are intervening in a way that helps save another person's life.
Correct. I think that's very profound, and I'm glad you're thinking ahead, that it's not just, here's a digital training, but a digital training that is, the information is digestible to everybody. It's one thing to build a product, but can that product be utilized by every single type of audience? So I think it will do well. And for someone listening, I'm very confident that you should be able to find an investor, because it's really fantastic work. And we're going to have you again for a part 2 series, because I feel that the work of Helpstation is very broad and there's more in the space. But just lastly, what is your favorite quote and why?
Yes. I haven't had one in a minute, if I'm being very honest. But if I think back, I used to have a favorite quote, which is, do unto others what you want others to do to you. And it used to be my reality check, such that if I wanted to do something, I would pause first and think, if I were in this person's shoe, would I want the person to do the same to me? So it really did help me in how I responded or reacted to things. Situations, people, and all. So
No, thank you. That's very helpful. So guys, you've heard from Dr. Yewande on everything Helpstation, their first line emergency response service for ambulance, paramedics, ambucycle, etc. If you want to find out more information on the good work that they're doing, you can follow their social media handles. Yewande, what are your social media handles and what's your website?
So our website is www.helpstation.ng. And then our Instagram handle is helpstation.ng. And Twitter handle is help_station_. So please follow us.
Awesome. Thank you guys for listening. And until next time, bye.